Questions for the two professors regarding excisional techniques? Yes.
Obviously, this is likely not an issue in your country, maybe, but in our country, you know, the CPT code for suction lipectomy is considered cosmetic. And while I think this sounds like an excellent option, offering patients liposuction in addition perhaps to vascularized lymph node transfer, if anybody has experience with this, how are you guys getting coverage for those cases when your ICD-10 code is lymphedema?
Excellent question.
Yes, for Sweden, everybody is covered with social security. So we order garments like you order medicine for hypertension. You get the right number of tablets, you get the right number of garments that needed. So there is no upper limit. That's why we have these good results. And even foreign students coming to Sweden are also covered. We had an American student coming to Sweden, have the surgery done, and then she thought it was so good, so she stayed there for 2 years and did a degree at the university.
Well, I guess I'd like to ask some of the American surgeons sitting in the front if you can shed some light on this issue.
Anybody want to comment on liposuctioning and coverage in terms of insurance companies?
I've started using codes that I learned from LE&RN. So I don't dictate them or build them as liposuction. I build them as minimally invasive excision of tissue, and there are CPT codes for that. And it's being paid. I've been using it for about 2 months now.
And they get through.
Yeah.
Yeah, you're absolutely right. When you start using liposuction code, it'll be cosmetic. But you'd be surprised. There are a lot of patients who actually pay tons of money out of their pocket to get this done. So, you know, so there are people who pay cash for these. But those who cannot afford it, you can use codes that Dr. Nelligan mentioned. I've been using that. Also, I got that from LE&RN as well. And reimbursement is not that great, but they at least get it covered.
Before we conclude, any other questions? Question about compliance. Håkan, what percentage of your patients are non-compliant? And Dr. Chen, do you have compliance issues?
We have total compliance. Because already after 5 minutes talking to the patient, I can see if he's a compliant patient after 25 years of experience. And those patients coming to us, most of them have very good conservative treatment. When you go back 30 years, it was not that good. So they come to us, and if they have a pitting like 1 centimeter, very unusual, I send a letter to the referral surgeon that this patient needs to continue with intensive treatment, bandaging, and then have garments, and then remeasure volumes after 3 months, and there is no or minimal pitting we can carry on. So patients are very diligent to follow they know the therapists in Sweden know what we want from the patients. So we see very few patients that are not compliant, and they will never be operated.
Generally speaking, all patients are very compliant, but only one thing, they are not compliant because Taiwan is very hot. So if you want them to wear the compression garment, it's sort of difficult. That's why we sometimes still need additional procedure like lymph node transfer to get better results. But I would like to ask you, when you do the lipectomy, did you suck the fingers or not?
Well, actually, I did in the beginning, but after looking on MRIs, there was never fat there, neither in the fingers nor in the dorsum of the hand or the feet. So the swelling there is just fluid, and fluid you can remove with conservative regimens. So I don't do any liposuction on the hand or the foot.
Okay,
I have a quick question. I have a patient right here. I treat a lot of patients with edema, all sorts of edema, including lipedema. And more recently, a patient of mine flew out to a center in Atlanta to get water-assisted liposuction. Her hemoglobin from a baseline of 13.514 dropped down to a 7 after she was done with the procedure, and she had more electrolyte imbalances. So my question is, what kind of complications do you see from a hemodynamic standpoint, electrolyte standpoint, when you remove that large volumes in your experience?
Well, I will talk about this later in my next talk, but I have the same experience. I saw one patient have water-assisted liposuction in Germany, and she went home after a couple of days and was admitted to the hospital due to loss of blood, and her hemoglobin content was 5, and she had 30 before. So using the tourniquet, as I showed you here, we can do up to 8, 9, 10 liters without any blood transfusions.
Thank you. I just want to close this. I think do you want to make a short comment,
That's
please?
welcome. For the very large lymphedema, very big limb, either you do the liposuction or do modified charts. There is potential risk because the patient may have bleeding. For example, that case, I presented, the weight was nearly 50 kilogram. It's about 1/3 of the body weight. So if you if the patient suddenly lose a lot of blood, or if there is sudden hemodynamic change, the heart will not be able to tolerate. So we must have close monitoring of the vital sign during and after surgery.
Okay, thank you. I want to thank our 2 visiting professors.